you come up with what you think is, we call the most politically viable and practical for Vermont. So how do we approach, the timing is I have to submit a plan by January 1st, and this coming year. They basically gave us 6 months to do it. So it's a very hurried job. Let me just conclude by telling you how we approach this. First, I want to map out what's feasible, politically feasible in Vermont. There are many interest groups. There are 2 major political parties in Vermont. And Vermont's governor is a Republican, the legislature are Democrats. What's that viable political space to create a major reform? Employers have a view. Employers want the cost controlled. They want the cost affordable. But the expenditure by the employers or by patients is income to the doctors and hospitals. They want more. This group wants to pay less. This group say, pay me more. What's viable between the people with different economic interests? What kind of compromise is possible between these groups? So without boring you further, is the first job we did is we went in to map out this what we call feasibility space. Then we actually then do the analysis, gathering the most evidence that's most relevant to Vermont's situation. Then we design the options, but for each option we do our best to estimate the impact. That is, how much it will cost. If there are savings, where does it come from? How much savings will produce? How would that impact on physicians, on hospitals? And more than that, the state also asked me to analyze what's the impact on the total economy. How would this impact on the employment? How would this impact on the cost of doing business in Vermont? Would that help Vermont's economy to grow? So we have a big job ahead of us, but I'm still delighted and honored to be here today to share this experience and knowledge with you, and I hope it's useful to you. And you have to decide where you want to go and how to go about it. But this is what Taiwan did, and this is what Vermont is doing. Thank you very much.
Thank you, Dr. Hsiao. And I thought before we launch into questions, maybe I might frame this a little bit for the committee. One of the reasons that we invited Dr. Hsiao is that we have a very specific charge as part of our charge as a committee. It goes from A to F, which is F is any other issue related to implementation, but this particular issue is in E, and let me just read, but it's how federal legislation affects the ability of the state to adopt a system of universal health care through a single payer plan or other mechanism, including the use of Medicare, Maine AllCare, and other state money to provide funding for universal health care in the state. And so that is our specific charge. And I would also mention that as we probably heard in the first meeting and may not have recollected months later, But the Affordable Care Act actually creates a space for an alternative state approach. As we've all heard, the centerpiece of the act is the insurance exchanges and many other provisions. But there is language in the act that says in the year 2017, any state can go to the federal government and say, well, we have an alternative way of providing health care in our state that we think will cover just as many people and won't cost any more than what's laid out in the Affordable Care Act, and we would like to have a waiver from its provisions, which is a standard practice over the past years, for states to experiment with something different. We'd like to have a waiver to do something different. So one possibility for waiver, and I believe this is what the state of Vermont has sort of looked towards, is potentially doing an approach that has a single payer to it. So just to frame it for the committee, it's very relevant to what we're doing today and what we're looking at as we make recommendations. And see if there's any questions for the doctor.
In Taiwan, are the businesses government run, or are they individual businesses in the company?
Taiwan has probably one of the most vibrant private business. That's why its economy was growing so fast. Taiwan actually privatized the industries that was owned by the government because Taiwan took over from Japan after World War II. So you had like the sugar industry and so forth was in the government. So government privatized it. And so Taiwan's economy is a private free market economy.
Other questions? Representative Foss.
Thank you very much. I actually have two. I'll limit it to two, though. The first is, what percentage of Taiwan's gross domestic product is spent on healthcare?
Taiwan right now is spending 6.1% of the GDP on healthcare.
And the second thing is, it seemed to me that you were saying that to have a standardized health insurance product, it would require single payer. But I have a fair amount of experience that we can have standardized insurance products without single payer. For instance, homeowners, automobile, and a variety of other insurance. Why do you think we have to have single payer to have a standardized product?
Thank you for that question. Let me clarify that. If you want to simplify the administration and also the administrative work imposed on the doctors and hospitals, then the single payer has one set of benefit package that everyone have, as well as one single set of rules and administrative procedures and the electronic systems they operate with. So that's one reason, but that's different from, if you look at the homeowners, let me just point out, in healthcare, the number of transactions are numerous, unlike homeowner or auto insurance, because on average, every person in the United States, I don't know the figure for Maine, for United States, on average, people visit a doctor about 5.8 times per year. Just multiply by your population. Look at how much transaction that involves.
Why I asked the question was, I thought I was familiar with other countries in the world that did not have single payer, yet had the other features that you describe. And I was thinking in terms of, I believe, Holland, and I believe Japan, and England, not England, Germany, and Switzerland for that matter. So it was, what I'm trying to do is tease out why single payer is the way you think we have to go, because that seems to be a huge issue in this country and a huge impediment to reform.
Let me explain what, let's say, what Germany does or what Holland does. Germany have many insurance plans, which is called sickness funds. But when they pay, but they all have the same basic benefit plan. That's a convention the states sign with the federal government in order to receive federal subsidy. And second, all their claims, although it comes from numerous insurance plans, all the claims are paid through what we call a single channel, payment channel. So that single payment channel establishes the rates to be paid, the payment methods and rates, and the procedures and rules. So yes, there are many insurance funds, but they are all required to offer the same basic benefit package, and then their claims are all paid through that. The amount of savings in Germany is less than what I described in Taiwan, but there are still savings. But we still, you can call it, Germany is a modified form of single payer. It's a single payment channel rather than one single insurance fund.
I have a question. You mentioned that, and it follows naturally from this, I think, you mentioned that single payer could be done through the government, but it could be done in some other way, not by being a government-sponsored plan. What would that look like, and are there any successful examples of that around the world or in this country? Of a non-government single-payer plan?
Well, since I just mentioned Germany, let me return to Germany. Germany operates its system through a sickness funds rather than the government runs it. Canada has a government-run system, decentralized down to every province in Canada. But the ones like Switzerland, which Representative Fossil mentioned, they delegate that job to a private insurance companies, but they are largely non-profit insurance companies. And they do it for every canton, that's a county. Switzerland is organized politically by cantons. And then each canton actually select a non-profit insurance company or insurance, some of them are for-profit, then to operate.
Are there other questions? Representative Priest.
Thank you. Can you tell us how you are thinking about handling the ERISA question when you deal with Vermont?
And can you explain what the RISA question is?
How you're going to deal with the federal ERISA law, which has a different qualifications for large employers than for small employers.
For a state that considers any form of single payer, regardless the pure form I call like Taiwan or the modified form like Germany or Holland, you are faced with this complexity that is the federal government have many federal laws and programs that really impact on the state in a serious way. And so Medicare has its own rules. Medicaid, of course, has its own rules. And even Veterans Administration has its own rules for veterans hospitals. And then you mentioned ERISA. ERISA basically says a state cannot pass any law that regulates self-insured plans. Is to give the self-insured health insurance plans the widest degree of freedom, what kind of benefits they will offer, how it's administered. It's one of the most constraining federal laws on the state if you want to move toward a single-payer system. In the project we're working with Vermont is very kind. Vermont has some experts in the state legislature's legal counsel office. And we're working with her and her colleagues, and we are consulting all the top experts in the United States.